So, welcome back. We continue with our conversation with Dr. Pranay Pardesi on oral cancer. Today, I'll be talking to him on what are the treatment modalities, the different stages of cancer, and a few more causative factors which we missed out on purposely because I wanted to give a lot more focus on the new in thing to do by the youngsters today, which is vaping. Vaping dog has taken over youngsters and house. You see school going kids indulging in vaping today. Does this have a direct relation with oral cancer also, vaping?
So, as I before also I made it very clear that tobacco consumption in any form, whether it's vaping, cigar, cigarettes, BD, is harmful.
Yes.
Okay. Of course, now kids have fallen prey to vaping even at the age which is of what 12 and 13 years
Yeah.
when they're in 8th or ninth grade.
Yes.
So there is nothing like a good habit or a bad habit. If you're vaping, it's a good habit, or if you're having a cigarette, I would keep them at par. Okay.
Yeah,
Of
because
course,
all
there's more of tar content in vaping that has been found out to be. So maybe directly it won't be having a direct effect on the
oral mucosa.
oral mucosa. However, your throat, your base of the tongue, your palate, your lungs are not spared.
True. So this is a misnomer that uh, vaping is better than smoking.
Absolutely, it's a misnomer. Absolutely.
Because a lot of people give up smoking and take up vaping and say that this is a healthier thing we are doing.
Not at all. It's just they have this psychological thing that they feel that we are vaping and we are not taking the cigarette.
Right.
Because cigarette has already been a social devil, and people look up to it as a social devil. So they feel that, oh, I'm not taking cigarette anymore, but I'm vaping.
Right.
But it is not safe as people think. It is uh, one of the causative agent of cancer.
I think they've banned vaping in some Western countries now,
Absolutely.
seeing that kids were, partaking of it. But in India, vapes have been put under the, it's illegal to have a vape.
Absolutely.
And yet you see small kids roaming around with all different fancy looking devices that they're vaping.
That's what I told you, madam. We have the rules, we have the regulations, but implementation is a big problem.
Okay,
Big problem. If you see the rules and regulation and all the acts and everything,
nothing.
so nothing being implemented.
So now let's come to our. We've spoken about the symptoms and how visiting the dentist early is important. But can you talk to us about the different stages and the treatment modalities? Because we know that oral cancer is the most disfiguring of all cancers, and it it just doesn't. It's not just a regular surgery, but it's a surgery that affects not just your physicality but your mental health also. Can you throw some light on that?
Absolutely. So, if you talk about staging, this is the first question that any patient asks to us is, doc, once they are diagnosed, they ask to us, doc, which stage we are in. So, for them it is always stage 1, stage 2, stage 3, stage 4. But for us it is stage 1, stage 2, stage 3, stage 4, stage 4A and stage 4B.
Yes.
So, till stage 4A we feel these cancers can be operable. Stage 4B sometimes may need some amount of what we call as a neoadjuvant chemotherapy. That is, we may need to give these patients some amount of chemotherapy, 2 or 3 cycles, before we take them up for the surgery, or sometimes we may directly also take them up for surgery and then later on give them chemo radiation. So this is what about staging. And when you talk about survival in this staging, stage 1 and stage 2 are supposed to have the best survival rates. And when you talk about disfigurement, stage 1 and stage 2 have the least amount of disfigurement. But unfortunately, we do not get many cases which are in stage 1 and stage 2. Most of the cases which come to us are either in stage 3, stage 4, where we either need to do, after the resection, we either need to do some sort of local or a free flap surgeries. And sometimes even, especially in stage 4 cases, where we even have to remove the outer skin of the patient. And once the outer skin is removed, we really need a big flap to close it. And that's why we have to go and do something called as a free flap surgeries, where we take either a fibula graft, that is the leg bone, along with some skin, or we take ALT flap, that is the thigh flap, along with some skin, and we put it over here, and we join it with the vessels of the neck to give the blood supply back to the flap. So, how much ever best we try to do in this, we cannot achieve what God had created. We can get back function almost normal, but it will never become normal.
True.
So some amount of disfigurement always remain, and of course your skin, which was there before, will never match the skin what you have put it back.
Absolutely.
So we will build. We will say that 80% we have built it back, but that 20% what God had created, we will not be able to create. It's like that. So somewhere we will achieve normalcy, but not to absolute normalcy. What
Very well said. Yeah.
is there?
Like besides the aesthetic part, oral cancer also affects your masticatory abilities, your chewing,
Absolutely.
your speech.
Yes.
There's so much, and because of that, the psychological difficulties that come with it. Tell me that is there anything besides going to a dentist early, going once a year, the staging of cancer, excepting the very aggressive cancers, most squamous cell cancers that we see, tumors in the mouth, they develop at a very slow rate. So patient does have enough time to even come to an oral surgeon at stage 1 and stage 2. So what are the kinds of cancers that are super aggressive that can move from one day not being there? There are dentists, like you've been to your dentist and you've not, you've been suddenly detected within 6 months of being to a dentist with a cancer. Is that a probability?
So actually, the thing is acceptance. This is what I have seen over past 9 to 10 years now, is that acceptance is not there. When you hear the word cancer, half the patient gets demoralized over that.
True, we've seen it.
Yeah. So the moment you use this word cancer, acceptance doesn't come in. So what they try to do is find an alternative. I'm not saying all of them would do, but at least 30 to 40% patient would try and find an alternative. They would either go and take some Ayurvedic help, or they would go and apply some ointment which is given by some doctor, or they would in any form find an alternative, or go to some therapist to get it treated. But when they realize that this is not working, they've already lost 5 to 6 weeks time, which in the case of cancer is a long span of time. And probably the stage 1 cancer has now become a stage 2 or stage 3 cancer. Maybe that disease at that time, what we could have just removed and primarily closed, must have now would need some sort of reconstruction option.
Absolutely.
Okay, so that's one thing. Second is, we need certain trained doctors who diagnose it moment they see it. Sometimes even our colleagues are unable to diagnose, and they say it's an ulcer. If you see an ulcer, keep it under observation. If you see a white patch, you keep it under observation. Call that patient again after 1 month. Or if you see some erythroplakia or reddish patch, keep under observation. Call the patient. If you feel you can give the gel right now, or give some sort of oral, say multivitamins or some carotenes or something like that, or antioxidants, give them, but call them back for follow-up.
I think
if it's not healing, please get it biopsy. We should not wait for and lose time, and then wait it to grow. And to your question that you asked, that is there any form of cancer? So as you know that squamous cell carcinoma we divide into well, moderate, and poorly differentiated. So poorly differentiated cancers usually have poor outcomes. It's to be said. And so squamous cell carcinoma is one of the most common. Say 90% of the oral cancers are squamous cell carcinoma.
So that comes to the next question, that so the patient's been operated for, say, the right buccal mucosa, and the cancer's been removed from that area, and like you oral surgeons, you're the most aggressive surgeons, you go all around and snip off all the tissue. All of that has been done. How good is his prognosis in terms of recurrence? Does he still, if he, obviously after all this, दूध का जला चाय भी फूक फूक के पीता है. So if that person's given up his habits and he's transformed his life, does he still stand a chance of recurrence in around that area?
Absolutely. So most of the time, the treatment doesn't get completed only with surgery.
Yes.
So there are certain protocols that you follow after the final report comes. Once you remove that with a safe margin, say 1 centimeter margin, and when we get the report, we see certain things. So after that, if you decide to give chemotherapy, radiation therapy, and once now the treatment is over after receiving chemo and radiation, still I always tell all my patients that you must come to us for regular follow-ups. Because despite the fact that everything is done, still there are chances that cancer can come back. Maybe in that area in the periphery, maybe at some other site, or maybe a distant metastasis can come. So these patients need to be screened regularly.
So when you say screen, a PET scan every 3 months initially and then once a year?
Not necessarily PET scan only, a sonography for the neck or chest x-ray. Of course, PET scan is one of the best modality to rule out distant metastasis and a good follow-up study, but it's a slightly expensive modality. Everyone cannot get it done every 3 months because it causes in a good center around 15 to 25,000 rupees, anywhere between that.
Yes.
But what we regularly follow up, if not a PET, we can go in for a sonography or an X-ray chest with local examination is sufficient along with
Okay, great. So I think that's been some really heavy information you've just shared with us.
Just to add on quality of life, especially in CA tongues, in cancer of the tongues, what we see is what you talk about swallowing, the food, that's what we earn for, right, to eat. We are unable to do so.
Really sad.
It's like that. And most of the oral cancers cause difficulty in eating. Most of them. And especially in the first 2 months, they're always on the feeding tube, the nasogastric tube. And most of the CA tongue patients, we need to do a peg, and everything happens to that peg tubes. So you can imagine what kind of life. And they also have a tracheostomy tube. So the speech is again affected. They're unable to speak because once you remove the entire tongue, the speech is completely gone. Because you cannot build a tongue which was helping you to create that phonetics.
The toughest muscle in the body. Yes. Okay, this has been some heavy duty conversation, Pranay. Let's leave it on a lighter note that we can prevent and save ourselves a lot of heartache and problems by going to your dentist early. And the way we practice at our clinic at studio is that each time I feel something is a little out of normal, I just pick up the phone and call you, and I get the patient to see you. Anytime I have my doubt, probably 80% of the time you say there's nothing to worry. But I'm so happy that a trained surgeon eye has seen it also and said, we'll call you back after a year. So I guess that's the way one should practice, that each time you have any doubt, call in someone who's only dealing with that particular thing, have a trained eye look into it, and early detection is the best way forward.
Early detection is the key to success in the cancer.
We'll leave it at that. Thank you.